A latest report from the New World Health Organization says the number of Caribbean nationals living with diabetes has tripled since 1980, showing that diabetes is a major health hazard in today's society and is among the leading causes of death here in Dominica. And the Dominica Diabetes Association held its annual general meeting at the Public Service Union today under the theme, Waste the Waste. And Pan American Health Organization representative for Barbados and the Eastern Caribbean, Dr. Godfrey Zureb, is in his presentation focused on diabetes and obesity here on the island.
This year, WHO published these diabetes country profiles in April. For Dominica, more than 1 in 10 adults have diabetes. This in itself is a worrying statistic. But even more worrying is the trend. Over the last 30 years, those diagnosed with diabetes in Dominica have risen from just over 5%, so 5 for every 100, in 1980, to almost 15%, so 15 for every 100, in 2014.
And Zureb stated the number of female diabetics has tripled in 1 generation, and the data states that in men, the situation is also alarming.
The data shows that in 1980, we had about just under 5% of men with diabetes, and in 2016, we have 10%. So the number of men with diabetes has also doubled. We know that one of the most important risk factors for diabetes is obesity. And here the data is even more alarming for Dominica. The same WHO report from earlier this year shows that over half of men and over 60%, so 6 out of every 10 women, are overweight. And a third of all women are classified as obese. So
Furthermore, over a quarter of all adults in Dominica are now classified as obese, he added.
Obesity in adults has reached epidemic proportions and is manifesting itself in the number of cases of diagnosed diabetics and persons with high blood pressures, as well as problems associated with these 2 silent killers. The problem gets worse when we see what is happening to our younger generation, the generation of the future, the ones who should be carrying Dominica into the next decades.
And Zureb indicated that the latest global school-based student health survey conducted in Dominica in 2009 revealed that a quarter of all students aged 13 to 15 were overweight, and 1 in every 10 students in that age group was obese. In 1 generation, we have moved from undernutrition to obesity and overweight, he noted. And he stated that a second major risk factor is the lack of physical activity.